This is the emergency department. Within the Southern Trust, the emergency departments at Craigavon Area Hospital and Daisy Hill see over 100,000 patients a year. We changed the term emergency department 2 to 3 years ago when we took the accident out. We wanted the public to realise that an emergency department is just for that, for the true emergency. Hi, this is our reception area, and this is where you'll come and wait for treatment in the emergency department. As you can see, it's quite a small area, it's very busy, and we have a limited number of chairs. That means that we would expect the patients to get priority seating here. So if you come with your relative, and if you see a patient who's standing, please remember that they are the patient and get up and give them your chair. When you come in here, this is our reception desk. You'll hand your patient details into our trained receptionists who will ask your name, address and some details of why you've attended the emergency department. Following this, they will then speak to the triage nurse who will subsequently triage you. In other words, she will decide what priority you should be seen in within the department. This is our triage nurse, and when you come into the department, she will do a full assessment of you. That will include taking your observations such as temperature, your heart rate, your blood pressure. She will ask you a few questions, and on the basis of that, she will decide where you will go to. Will you go to the minors area, the majors area, or do you need to go to the resuscitation area? This is our minors area, and this is the area where if you've got a minor cut, you've got a minor break in the bone, or you've got a burn, you may well be brought to this area to be assessed. There are a team of doctors and nurses who are allocated to specifically work in this area. Now at times and during busy times you may wait to be seen, because remember, it is a minor complaint. We have to deal with major problems first. But we do know that you're in the department. We have a screen up here which gives us a full list of the patients both in this department and waiting to come into this department. So it's managed very closely by a senior doctor and nurse who are aware you're there. This is our majors area, and this is where you'll be brought if you have shortness of breath, tummy pain, potential for a heart attack, maybe a mini stroke. You may be brought here from triage directly by the triage nurse, or you may be brought by ambulance. And at the very bottom, if you're brought by ambulance, you're met immediately by an experienced nurse who will triage you again to make sure that you get to the right place at the right time. In this area again, we have separate teams working. We also have teams from the wards coming down to give opinions on patients. So even though you may be waiting in here, there is always something happening. For instance, you could be waiting for results of investigations to come back. You could be waiting for a specialist from the surgical department or the medical department coming down to give an opinion on you. So we intend to have this as a very active place where things are always happening. This is our ambulance screen, and this tells us at any time of the day or night what ambulances are en route to us, gives us a rough idea of what's wrong with the patient, so it means we can be prepared to receive you. This is our clinical decision unit, and it's a short stay unit. In other words, if you've got a minor head injury, you've had a minor infection of your arm or your leg, or you've maybe taken an overdose and require mental health input, you may be brought to this area to stay overnight. And generally patients remain here for less than 24 hours. It is a proper ward. It has the same things in it that you will have in a ward anywhere else in the hospital. Within this area are a very highly trained staff who are trained in giving advanced life support, who are trained in monitoring you very closely, and who work very closely with our anaesthetic and intensive care colleagues to make sure that you get the best of care. At times this unit can be very busy, and we have 5 beds in it, and those beds are used most of the time. So while you're sitting waiting to be seen elsewhere with your minor injury, you have to be aware that within this area people are fighting for their lives, and we are fighting for their lives. So it's not that we're standing around doing nothing, it's that we're providing life-saving treatment to our patients. Remember, emergency departments are there for emergencies. We're dealing with hundreds of emergencies on a daily basis. So I'd ask the public to think before you use the emergency department. Are you really an emergency? Or is there any other way that you can deal with your problem at that particular time? Remember, You've got pharmacists that can give advice on medications, can treat minor illnesses. You've got your GP both in hours and out of hours. And also remember, there's self-care. Simple cuts, simple bruises, simple illnesses can be treated by yourself at home. Last but not least, remember, we have minor injuries units within the Southern Trust.